Madison, how are you today?
Good.
I'm going to close these. I'm your nurse. I'm Amanda, and I will be doing a head care assessment today. I'm going to gather my supplies and wash my hands.
Okay.
I just want to start off with some basic questions. What is your diet like?
I'd say it's pretty healthy.
Okay. Patient seems healthy. What is your, do you have any history of illnesses or diseases?
No.
Okay. Do you have any problems speaking?
No.
Okay. Patient has no abnormalities of speech, has good posture, and how are you feeling today?
All right.
Okay. Patient seems happy, and you have no deformities or assistive devices. Okay, Maddie, I'm going to take your vitals now. I'm going to gather my supplies, my thermometer, my blood pressure cuff, and my pulse oximeter.
Okay.
Okay, I'm going to put this on your finger. I'm going to take your temperature, right under your tongue for me. Okay, patient's temperature is 98. Okay, and now I'm going to take your blood pressure. Patient's O2 is 96. Patient's blood pressure is 117/74. Now I'm going to record your pulse for 1 full minute. Okay, patient's pulse is 76 and respirations are 18. Can you come over here and I will get your height and weight? And step on for me, face that way. Right, is that snug on your head?
Yep.
Okay, go ahead and step down for me. Patient is 5'6". Now can you step on and we'll get your weight. Patient weighs 137 pounds. Go ahead and step off for me. I'll have you sit right back up here. I'll just ask you a couple of questions. Can you tell me your name and date of birth?
My name is Madison. My date of birth is 1/24/97.
Okay. Do you know where you're at?
Yep.
Where are you at?
Davenport.
Okay. And what is today's date?
Oh, April 12th, 2019.
Yes. Okay. Patient has no signs of disorientation. Okay, patient is alert and oriented ×4. Do you have any pain today on a scale of 1 to 10, with 10 being the worst pain you've ever experienced?
Maybe 1.
Okay, so patient pain is level 1. Okay, Madison, I'm now going to check your hands, inspect and palpate those. Thank you. Now I'm going to check your capillary refill. Okay, capillary refill is less than 2 seconds. Patient's hands seem moist, warm, and they are white with a light pink pigmentation. There's no signs of hypopigmentation or cirrhosis. Patient's skin is free of any lesions. Now I'm going to check your skin turgor up on your clavicle just to see if you're dehydrated. Okay. Turgor skin returns promptly after pinching, and there is no tenting. Now I'm going to check your hair in 3 places. Okay. Patient's hair growth is symmetric. There's no signs of unusual hair growth or alopecia. Okay, Maddie, now I'm going to inspect your head in 3 different places. Okay, patient's head seems free of any lesions. There's no deformities or tenderness. Now I'm going to inspect your face. Can you look at me? Patient's face is symmetric, free of lesions as well. There's no signs of edema. And now I will have you smile for me. Okay, can you frown? Okay. I just did cranial nerves 5 and 7, and they seem to be intact. Now I'm going to palpate your temporal artery. Okay. Patient's temporal artery is graded 2. And now I'm going to palpate your temporal mandibular joint. Okay, can you open and close your mouth for me? Can you move your jaw side to side? Okay. Temporal mandibular joint moves smoothly without any limitations or tenderness. Okay, Maddie, now we're going to move on and inspect your eyes. Can you look at me? Okay. Eyes seem symmetrical, where there's no scaling or lesions. The eyelids and eyelashes are intact. There's no redness or swelling or discharge. Eyelashes are distributed evenly and they flare outward. Now I'm going to slide the bottom of your eyelids down to inspect your conjunctiva and sclera. Okay. So the conjunctiva are clear white, while the sclera are a little pink over the lower lids. Now I'm going to test your visual field, specifically 3, 4, and 6. Can you follow my finger while I do the 6 cardinal? Oh. Okay, patient was able to follow my finger. There was a smooth movement with no nystagmus. Now I'm going to inspect your pupils and your irises by using my pen light. I'm just going to shine this light into your eye if you can look at something off in the distance so I can see if your pupils constrict. Okay, good. Patient has consensual light response. They are both accommodate to each other, which means cranial nerve 2 is working. Now we're going to inspect your ears. I'm going to look at both ears. Make sure. Okay, so patient's ears are symmetric. There's no swelling or thickness, and the auricles align with the bottom corners of each eye. The skin is smooth and free of lumps, and the skin color is consistent with the facial color. Do you have any discharge of your ears?
No.
No? Okay, patient refuses discharge. Now I'm going to move your pinna and your tragus, and you tell me if you have any pain. Any pain? Okay, patient refuses any tenderness. Now I'm going to inspect your external canal. Just take a look. Okay, there's only a little bit of yellow earwax, and there's no swelling or discharge. Now we're going to move on and do the whisper voice test. I'm going to have you cover one ear, and I'm going to whisper 3 things behind you, and I'll be 2 feet away. Cover your right ear for me.
1, 2, 3.
Okay, and now we're going to do this ear.
A, B, C.
Okay, so the patient passed the whisper voice test, and I was testing cranial nerve 8, which seems to be intact. Okay, Maddie, we're going to do an inspection of your nose. Just going to take a look. Okay, patient's nose is symmetrical and free of deformities or lesions. The skin feels smooth and slightly moist. So now I'm going to inspect the internal nose with using my pen light. If you can tilt your head back for me. Okay. Patient's mucosa is pink, seems moist. There's no swelling or discharge or bleeding. The septum is symmetrical, and I'll have you plug one side and breathe in for me. And now the other. Okay. So the septum is symmetrical, and the patient is able to sniff through both nostrils. Okay, Maddie, we're going to inspect your mouth now. I'm going to just take a look at your lips. Lips are pink, moist, and they're free of lesions. Now I'm going to look inside your mouth with my pen light and just look at your teeth and your tongue. Okay, there are 32 white teeth present. The gums are pink. They have no lesions or swelling. Do you have any tenderness of the gums right now?
No.
Okay, so now I'm going to inspect the uvula and tonsils, which is cranial nerve 9 and 10. Can you open your mouth and say ah for me? Okay, can you stick out your tongue? Okay. So patient was able to stick out their tongue, and the tonsils were a grade 1, meaning that they are visible. I'm going to have you stick out your tongue one more time, and I'm just going to inspect that. Okay, the tongue protrudes at midline. It's smooth and shiny pink with moist, and let me look underneath your tongue real quick. Okay, there are veins visible, and cranial nerve 12 is intact. There's pink and vascular, no growth. The hard palate is intact. Let me just take a look real quick. Open up for me. Yep. Hard palate intact, and there are no irregular forms. Move on and do your neck, and I'm going to feel your lymph nodes, specifically your pre and post ocular, your subclavicular, occipital, submental, submandibular, jugulogastric, the superficial cervical chain, and the posterior chain. Any tenderness at all?
Nope.
Okay. Patient has no tenderness. The lymph nodes were palpable and symmetrical to midline. Now I'm going to do the range of motion of your neck. Can you look down for me and have your chin touch your chest? Now all the way to the back for flex and extend. Now go ahead and tip your head side to side for lateral flexion. Okay. Patient is able to move neck side to side smoothly. And now we're going to do a shoulder shrug test. Can you lift up for me against my resistance? Okay. Patient can do this well and strength is adequate. Now I'm going to push on the side of your cheek. Can you go against my hand for me? Okay. Now this way. All right. Patient strength is adequate here as well. Okay, Maddie, now I'm going to inspect your posterior chest. Can you turn to the side for me? Okay. Shoulders are symmetrical. Can you bend down a little bit for me so I can inspect your spine? Okay, spine is straight, skin is clear with no lesions, and the shoulders are symmetrical with scapulae, and spine is palpable and straight. There's no bulges or inner spaces. Now I'm going to listen to your, take a deep breath for me, please. Okay, is there any tenderness there?
No.
Okay, now I'm going to palpate right where the ribs meet. Any tenderness?
No.
Okay, patient says there is no pain. Now I'm going to listen to your breath sounds.
Okay.
Take a deep breath when I say. Go ahead. Now over. Now down. Over. Down. Over. Down. On the sides. On the side. Okay. Breath sounds are heard in all places. And respiratory rate was 17. Patient has normal breath sounds. Okay, there's bronchial, bronchiovesicular, and vesicular sounds.